Almost 1 in 5 people in the UK are over 65, a number that is expected to hit 25% by 2050. Around 60% of the demographic have a long-term chronic condition. Remote patient monitoring, or RPM, uses digital technology to collect health data outside of conventional clinical settings, aiming to alleviate the burden of treatment and pressure on the NHS. In this video, we aim to present the following: analysis of the current status regarding RPM within the NHS, exploration of the challenges in widespread implementation, and a policy solution for the rollout of remote patient monitoring.
Remote monitoring solutions are currently being piloted in exemplary trusts within the NHS, particularly for those suffering from long-term conditions. For example, findings from a remote monitoring of rheumatoid arthritis study provided proof of principle in integrating patient-generated health data into the electronic health records of an NHS trust in Manchester. The patients involved in the piloting of this remote monitoring solution reported greater satisfaction due to the more valuable, patient-centred management of their care, as well as timely interventions by healthcare professionals as and when required. The NHS, among other governmental organisations, have officially provided public recommendations to enable virtual triaging and risk stratification of patients, particularly across primary care. NHSX have launched a dynamic purchase system which will streamline the procurement process by NHS organisations and propagate movement towards widespread use of technology in remote care. Work is being done by such entities to further improve the interoperability of patient-generated health data in the NHS patient records through intermediate cloud repositories, as well as through toolkits and resources as guidelines for procurement.
Based on pilot studies, these are the challenges that we have identified. The technological landscape of the NHS is segmented. There must be equal and widespread interoperable health records that can be integrated easily without being tethered to a specific system, such as EMIS or Cerner. Redesigning clinical pathways to improve flow of patients will require an increase of funding. The recent merging CCGs in April 2020 may prove to be beneficial in terms of improving information exchange between groups. However, CCGs represent 1 to 3 million people. This is far too great a number to ensure well-supported implementation of RPM and risks neglecting rural communities in the UK. Lastly, the implementation of RPM not only requires a robust framework, it also requires a great deal of education and awareness in the general public. Studies have shown that the ageing population and those with a lower socioeconomic background may require further support. A lack of consideration for these factors could widen the socioeconomic disparities within the population.
In order to tackle these challenges, we first scrutinised Denmark, who was touted as a benchmark for RPM expansion by the European Commission through its initiative, Telecare North. The reasons why they were so successful was due to the government's prioritisation of digital health, where a huge funding of 46 million was dedicated solely on the dissemination of telemedicine. Also, there is great interoperability across systems with fully electronic health records and reorganisation of care to facilitate cooperation between stakeholders. In view of the next government spending review estimated to take place in November 2021, we have come up with a three-pronged approach to tackle the challenges to widespread implementation of RPM solutions. Firstly, we will create NHS Access, a new subdivision within NHSX incorporating suppliers, representatives from the MHRA, CCG leads, and primary care network leads to streamline communications channels. This team will serve as an inter-organizational service center to facilitate smooth flow of information and consolidate feedback for improvement. Secondly, we will allocate £840 million to NHSX to invest in RPM and FIRE. This will be done by redistributing a proportion of the NHS budget capital from acute services to primary care and preventative services, given that demand for acute services will fall as RPM has been known to reduce A&E admissions by 25%. Lastly, we will launch a nationwide educational campaign to promote RPM and tackle any resistance surrounding the adoption of healthcare technologies. The campaign will also focus on data protection and ensuring equitable access across all socio-economic groups.
Is the NHS ready for remote monitoring solutions to be rolled out? This depends on the ability of the NHS to overcome the challenges it currently faces, whether it be the lack of digital infrastructure, making interoperability of health records hard, organizational barriers and cost limitations, or the issues associated with access and compliance to RPM. To best prepare the NHS for these technologies to be incorporated, it would need the creation of NHS Access, contractual investment into RPM, and a launch of a nationwide educational campaign. RPM is the future. So to conclude, with the policies proposed, the NHS will be ready to roll out remote monitoring solutions.